right. Go and get started. Good morning, everybody. Welcome to today's Share and Learn on key updates and essential resources for LOHPs. I'm Janelle Urata, part of the COHTAC team at UCSF. Thank you so much for joining. We'll get started since I know we have a full agenda. If you can go to the next page, please. We're funded by the Office of Oral Health. You can see here our acknowledgements and disclaimers. And before we begin with the main event, I'd like to share a few quick housekeeping reminders. Just wanted to remind you that today's webinar will be recorded and will be posted on the COHTAC website and the YouTube channel. You'll also receive a follow-up email in about a week with the recording link, slides, and resources shared today. We welcome questions and discussions in the chat box, and we'll also use the chat box for resource sharing. So we'll have a chance to answer some of the questions at the end of each presentation and also at the end of our session. And finally, as always, we value your feedback. So please take a moment at the end of today's session to complete our evaluation survey. Xenia will drop that in the link in the chat later on. So with that, let's begin. Thank you. So you'll see our objectives on the left side and on the right side our agenda. Today's session focuses on updates from COHTAC and practical resources for local oral health programs. We'll start with COHTAC Director Dr. Kristen Hoft and Research Analyst Khadija Ali. They will provide an overview of what to expect from COHTAC over the next 2 years. We're also joined by Pamela Vera from Gainwell Technologies, who will familiarize us with Smile California resources, and Anthony Eleftherian from UC Berkeley's Health Research for Action. With Kristen, they will walk us through COHTAC's website and review the resources on communication guidance and the oral health literary toolkit. And at the end, we will have a short segment led by Khadija, highlighting additional resources and shared tips from the recent convenings. Xenia will share the speaker bios link in the chat so you can read more about each presenter. And with that, I'll turn it over to Kristen.
All right. Thank you, Janelle, and welcome everybody. It's really great to be back in a Share and Learn after a little bit of a break. And I also want to thank everybody for your patience. This is our first Share and Learn in a long time without Aubrey, who is out on parental leave. So we're very happy for her, but bear with us as we all learn how to do, she used to do a job of like 4 people. So anyway, it's my pleasure to discuss what to expect from COHTAC over the next 2 years. We've had some slight changes to what we're able to offer. And so I just wanted to be clear about that and be sure that we can answer any questions. So most of the things that COHTAC provides are not changing. Our website is still there, and we're going to go into it more today. Our toolkits are still there. We are still updating and maintaining them. The webinars, like the Share and Learn, will stay the same. We do about 6 per year, and that will continue. And we are still here for all of you in terms of our one-on-one support. You can always email us. We can set up Zoom meetings or any other support that you need. And we also still will be supporting the California Partnership for Oral Health, or CPOH, work group support. So there's a few work groups that work throughout the state on different topics, and we take the notes and do the agendas and just kind of help coordinate those. And we'll still be doing that under the guidance of Rebecca from our team. And as always, we will continue to do info sharing and coordination for everybody. We are adding monthly office hours. We did one in August, and we are doing another one next week. We'll talk about that a little bit more later today. And we're also going to add quarterly meet and greets. So I know a lot of LOHPs get new staff or there's some turnover. And so we'll be holding kind of quarterly meet and greets as a welcome for people who are new staffs, and the general orientations you can get to meet the COHTAC team. And we can also walk you through our resources and what's available and how to use them. We will not be doing an in-person convening anymore in the next 2 years. And our team has changed just a little bit. Most of us are still here. Khadija, who you'll hear from, Dr. Behrens, who is our public health dentist on staff and is helping a lot behind the scenes. Rebecca Hargreaves, who supports the work groups. Myself, Aubrey's temporarily on leave, but will be coming back in March. Xenia, who some of you may have met at the convening in May, is here and has been a great help to add to our content. And then Janelle Urata is here, and she's new. You may not all have met her yet, but she is taking over some of the work that Bahar, Dr. Amanzadeh, and Katie Conklin used to do. So she's going to be covering the school work group and all the resources around school programs. Um, and you'll notice Gustavo is also gone. We really loved his time with us. And so we are all kind of shifting and changing a little bit of what we do, but our hope is to make the experience for you still really smooth. And so you can always email us instead of wondering like, ooh, who's the right person for this question? Just email us at this COHTAC email address. We all have access to it and we're checking it regularly and we'll make sure that your question gets to the right person. That way, you don't need to worry about who to send it to. Just send it to oralhealthsupport@ucsf.edu. All right, so I want to take a moment and talk about office hours, this new way that we have to provide technical assistance and provide opportunity for LOHPs to meet each other, learn from each other, share resources and tips. So we will be holding these on the fourth Tuesday of every month from 11 to 12. And they're really just for you. So you can drop in, ask a single question, or you can stay for the entire hour and hear from what everybody else is sharing. And it's so that COHTAC, LOHPs, and Office of Oral Health will be inviting the program consultants and grant managers as well. So we can get to know each other, answer questions, share ideas, and all kind of, stay on the same page. So the next one is next week, next Tuesday, and sometimes we'll know what the topic is in advance and announce that. But this time, since we're still kind of new to the office hours, we wanted to give a poll for you guys about what topics you would like in our next office hours. So the one in October and the one in November. And then in December, we will cover preparing for National Children's Dental Health Month. We'll share the resources that we already have available at December, what kind of like plans and activities you can do. And then also you guys can share with each other. And as we move into 2026, we'll talk about some of your deliverables. So, all right. So here's the poll. So go ahead and take a moment to vote. It's multiple choice, so you can select, they can select more than one, right? Or maybe just one, I'm not sure. Thank you guys all for voting. All right, I think. No, a few more people. So we'll wait just another moment. If you're done voting and also want to add any questions or suggestions into the chat, feel free to do so. We'll be going over those at the end. Senia, do we want to show the results?
Yeah.
Or maybe I get stalled out a little bit.
Should I end it?
Yeah. All right. Can everybody see the results? Um, Great. Thank you guys so much for giving your suggestions. We'll be reviewing these and sending out an announcement tomorrow with the details for next week's share and learn, or I mean, sorry, next week's office hours, and also planning for November. And if you have any additional suggestions, please feel free to email the COHTAC team or put it in the chat or chat with one of us. Anytime you have a thought, even if it's after next Tuesday, we're always willing to listen and get suggestions. And then the meet and greets. These are going to be the first week of every 3 months from 10 to 11. And this is especially for new members on your team so that they can get to meet some other people, get to meet COHTAC team, and then we'll also be able to walk through the COHTAC resources, kind of like some ideas about where to start, how to ask for help. And we'll be posting these into the events on our website and sending out emails to the listserv. So if you ever have anyone new to your team, highly recommend they join this. And also, if you just want a refresher and want to say hi, you're welcome. Um, so the share and learns, like today, we'll be continuing those. They're going to be held on the third Thursday of a month. We don't do it every month. It just kind of depends on the availability of our speakers. Some of the topics that we plan to cover in the future are partnering with Head Start, new data resources from the Office of Oral Health. That one will be in December. Water fluoridation and other forms of fluoride, and then analyzing and communicating with COA data. And we're also open anytime you have suggestions for share and learn. I think this is Khadijah.
Yeah, thanks, Kristen. Hi, everyone. So, we want to ensure that you all stay connected with us and each other. So, here are some ways that you can do that. COHTAC is active on LinkedIn, YouTube, Slack, and Facebook. So, on LinkedIn, we share updates and help promote any of your job openings through our own posts. And then you can, like as mentioned earlier, you can also catch up on all of our share and learn webinars anytime on YouTube. If you happen to not be able to make one, or you leave early or you joined late, the full recording will be uploaded on to YouTube. And also, Slack is a great space to connect directly with other LOHPs, share ideas, and ask any questions that you have. And then on Facebook, we are happy to share and repost your posts to help boost engagement and visibility across the network. Um, so we noticed that Slack hasn't had much activity lately. So we want to make sure that everyone knows how to access and use it or use the space to connect, ask questions, and share resources with each other. Um, Here we have some quick screenshots showing how to adjust your notification settings, whether you are using the app or your browser. So when you log into Slack, start by going to the bottom left corner, as you can see with the arrow, where your profile icon is. Click on it and then click on Preferences. After you click on that, there will be a new window that opens up with your settings options. And on the left-hand side, you'll see tabs like Notifications, Navigation, Home, Appearance, and Messages and Media. So you can explore each of these and customize your settings to make sure you're getting notified about the updates and conversations that matter most to you. And on this slide, we'll be talking about setting up email notifications. So once you click on the notifications tab and you scroll all the way down, you'll see that there is an option to set email notification. So when you click on that, a new tab will open up in your browser. And you can see here on the left side or on the right side, here is where you can set up and customize your own email notifications. So under the email notification section, you can choose how often you'd like to receive updates. For example, within 15 minutes, within the hour, or never if you're marked away or someone mentions you directly. There are also additional options to receive news and updates or sign in notifications depending on how you'd like to stay connected. Um, so yeah, thanks.
Great. Thanks, Khadija.
Mhm.
Um, yes, and if you ever need any help getting access to Slack, you can email us at oralhealthsupport@ucsf.edu, and we are happy to meet with you and help you walk through getting registered and making sure you know how to navigate it. It's a great space to get information and to chat with each other. So now we are going to spend a little time chatting. How can COHTAC support local oral health programs? So we're going to put you all in breakout rooms just for a few minutes called like pair and share. So when you get into your room, you can select someone to take some notes and share in round robin. If your group has mixed attendees, if we could prioritize the LOHPs to go first to make sure they get a chance to share their ideas. So your name, your organization, and then ideas on how COHTAC can support LOHPs. And also any questions or comments you have for your COHTAC team. And if the note taker can just keep track of this and share it back with us. So you've got 5 minutes. Before we go, would anyone like to share out any suggestions they have or put some ideas into the Slack? I mean, not the Slack, the chat.
Well, I'll say something. I've been doing this for about 8 years. This is Jennifer from San Benito County, and I utilize all this stuff, and I'm just so happy to have the recordings and the resources to give out. But one thing that I always need, for example, I have 4 schools left with about 100 in each school, and I don't have any more toothbrushes to give out or kits. So Gustavo just told me that I can ask Dwayne Calloway at Gainwell for some stuff, and I didn't know that. So I'm going to definitely be doing that. So I'm happy for anything like that, incentives. That's wonderful to know. I had no idea.
Yes, reach out to me anytime, Jennifer.
Oh,
I'll send you
there he
whatever
is.
you need.
Thank you. I had no idea.
Fantastic. Anything else? You guys, I don't know if you had time to get to it, but feel free to share anything else in the next minute or two. Ariel, go ahead.
Yeah. So from our group, we really talked about just some of the upcoming deliverables, in particular the needs assessment, and really hoping that through COHTAC, the LOHPs can kind of be a unified voice or as unified as possible to try to demystify our work plan, right? So when we talk about a needs assessment, or for those of us who already had one, an update to that needs assessment, what does that really mean? What is the level of work that is expected? What's the level of work that's required so that when we submit something, we are doing what we need to do, but also not doing so much extra work that, of course, takes away from time that we could be doing other elements of our work plan given our limited resources. And I'm seeing that more people, not just from my group, are clapping and thumbs up, and seeing head nods. So it seems like speaking to something that others feel as well.
Yeah, great. Thank you. Jennifer.
I was in room 4, and as a collective group, we are really excited about the upcoming office hours. We have appreciated all the templates that have been provided on the website, all the tools. It's been really helpful. And we loved the extension that we were provided on meeting the deadlines from August. Just like Ariel said, the demand of implementing and actually being in the community, doing the work in the community and doing the reports, it gets overwhelming. So having those extensions and those templates have been helpful. Thank you.
Fantastic. Well, thank you guys. If the note takers can feel free to send an email to COHTAC or add more to the chat. And I hope you got to meet a few other people. And so we're going to, Michelle, one last comment. Go ahead.
We were wondering if there's any resources or help from COHTAC to put the word out if local oral health programs in rural areas have access to an empty dental van to help promote getting maybe a young dentist or hygienist fresh out of school to give them the opportunity to come and help serve rural areas that have high Medi-Cal population. If there's any resources to help with that.
Yeah, we have a few, but that's something that we can emphasize and enforce. I know it's a consistent ask.
Okay, thank you.
Thanks. Thanks, you guys, for participating and sharing some of your ideas. We are now going to move on to the next section, which is essential resources. If you guys have more things to discuss, maybe we can save it to the Q&A at the end. And so it's my pleasure to invite Pamela Vera from Gainwell and Smile, California, to discuss their resources.
Thank you. Sorry, I didn't hear earlier. Did you have the PowerPoint or did you need me to share it?
Oh, Kristen, you're muted.
You're on mute.
Yeah, sorry. Do you have it? Otherwise, I can open it.
Yeah, if you can go ahead and just be easier. I could just tell you to go next slide.
Okay.
You're already sharing, right?
Yeah. Give me one moment.
Sorry, everybody.
I thought it was in here. No, it's in things.
If not, Gustavo, I think you have it ready, right?
Yes, I do.
Okay. I can have Gustavo do it. It's no problem.
Okay. Thanks. Sorry.
No, it's fine.
Let me know if you can see it.
It's coming.
Perfect. Sorry, everyone. Good morning. All right, I'm here to present Medi-Cal Dental Smile, California. As mentioned, my name is Pamela Vera. I am the member trainer here at Medi-Cal Dental. We also have Gustavo Leon, who will be assisting me with any questions you all may have. All right, let's get started. Next slide, please. Perfect. All right. So today we are here to talk to you about some of the resources that your teams can use for Medi-Cal Dental, specifically on the Smile California website is where I like to start, like co-branding opportunities, primary care physician and partner toolkits, smile alerts, and how to host an event with us. We will also be giving an overview of our member and provider outreach team, and then we'll end with teledentistry, care coordination, and case management. Okay, next slide. All right. Now I'll be giving you an overview of the Smile California resources. Okay, here are the web pages, smilecalifornia.org, and we also have the Spanish version, which is sonriecalifornia.org as well. This website does serve as an essential hub, and I will be highlighting specific sections in the next few slides. Next slide, please. All right. So one of the most impactful tool that can be used is helping members find their dental home. Dental home ensures members have a trusted provider for regular checkups and preventative care. The Find a Dentist tool on Smile California website helps Medi-Cal members locate a dental provider nearby. The steps are simple. You would visit smilecalifornia.org and click the orange Find a Dentist button at the top of the page. Select the provider directory link. Then you would enter the member zip code to find providers in their area. Be sure to use our Smile Care Plan so you can help provide members their top 3 choices, making it easy for them to take the next step in scheduling a visit. The Smile Care Plan is available on our website and can be accessed in 9 languages, ensuring it is a great resource that serves our diverse communities. Next slide, please. Okay. We also have tools available to support the efforts in promoting Medi-Cal Dental within the communities. To make outreach efforts easier and more impactful, we have a variety of free promotional materials which are designed to engage members and help spread awareness about the importance of oral health. They will have access to items such as informative flyers and posters, fun activity sheets for kids, and ready to share social media images, complete with suggested captions. Additionally, website and email signature banners are available to reinforce Smile California's message across digital platforms. With these tools, you can inspire members to take simple, meaningful steps towards healthy dental habits and connect them to the benefits Medi-Cal offers. Thank you. All right. We also offer co-branding opportunities, allowing you to align the organizations with Smile California campaign. You can request to feature your organization's logo on a variety of materials. These include social media posts, videos, print materials, and more. For organizations with media budgets, we also offer paid co-branding opportunities to expand your reach even further. Submitting a request is simple. You can scan the QR code on this page, or you can go on the website to smilecalifornia.org. Our team is here to help support in customizing materials that help inspire healthy smiles and engage members in your communities. Next slide. All right. I will now be highlighting our Smile California Partner Toolkit. This kit is designed to enhance local events and help members learn about Medi-Cal dental benefits in a fun and engaging way. Each kit, you will find brochures, flyers, posters, and toothbrushes for adults and children. To order a kit, you simply order a request form, which you can find on the medical.org website. All right. Next, I do want to highlight the Smile California Primary Physician Toolkit. These can be utilized for reaching out to, let's say, health plans or safety net clinics to provide oral health educational instructions. This provides information to primary care providers on what's available as far as good oral health practices that can be provided to members. If working with physicians and medical offices, here is a list of resources to share with them. These can also be found on the smilecalifornia.org website. Sorry, you went back. So yeah, this is the list. Sorry. Okay, next slide, please. There you go. All right. So be sure to stay connected and up to date with everything related to Smile California by signing up for our Smile Alerts. By joining our email list, you can receive timely updates on campaign activities, free resources to support your outreach efforts, and the latest information on Medi-Cal Dental. It is quick and easy to sign up. You can scan the QR code on this page, or you can email us at hello@smilecalifornia.org to get added to our list. This is the best way to ensure you never miss an opportunity to access new materials, share helpful tools with your communities, and stay informed about how you can support families. Okay, now we'll be giving a brief introduction to our Medi-Cal dental member and provider outreach teams. All right. So on the screen, you can see a map that highlights the Smile California representatives across the state. These dedicated members of our team are available to help with a variety of outreach and support efforts. Each region has a designated representative who can assist you with connecting families to dental providers, sharing educational materials, and hosting local events. Go ahead and use this map to identify the representative in your area and reach out for additional support. For our Western Southern member outreach representative, we have Jose Morales. For Eastern Southern, we have Unique Guy. For Northern, we have Darren Vinson. And for our Central region, we have Dwayne Calloway. I'll be sure to have them drop their emails in the chats. This QR code allows you to access this map as well as other important websites such as the Medi-Cal dental training events, the Smile California website, and many more. Slide. All right. If you are planning an event, you can reach out to us at hello@smilecalifornia.org or Medi-Cal Dental Outreach, SNC, at gainwelltechnologies.com. Sorry, that's a long email. With the details such as the event type, location, the audience, and expected attendance. We will work with you to determine how we can best support your efforts. Our support does include printed resources, promotional materials. We also offer Smile California representatives, like the ones I mentioned, who are available statewide to answer questions about Medi-Cal dental benefits, provide referrals to dentists accepting new members, host presentations, also participate in community events to share information and promote healthy habits. By partnering with us, you can make a significant impact in helping families discover the importance of oral health and access to the dental care they need. Now I will be giving an overview of teledentistry, care coordination, and case management. All right. Teledentistry is a Medi-Cal benefit offering members convenient access to dental care through phone or video consultations. A list of providers who offer teledentistry is available on the Medi-Cal dental website, also on smilecalifornia.org, and the Spanish version, sonriecalifornia.org. Next slide, please. Okay. Our Medi-Cal dental care coordination team is here to support members with their dental needs, like scheduling appointments, especially when members have multiple visits or need help keeping track of them, finding a general dentist or specialist, language assistance, including interpreter services and American Sign Language, and transportation coordination for members who may have trouble getting to their appointments on their own. The care coordination team is here to make access to dental care easier and more manageable for Medi-Cal members. All right. Care coordination can be completed by the member, WIC staff, family member, or dental staff. If you are unable to complete the care coordination form and the member needs dental services, you can also call our telephone service center at the 1-800-322-6384 number, who are available Monday to Friday from 8 a.m. to 5 p.m. Right. Case management is here to help members with special medical, physical, and or behavioral needs. Case management is designed for Medi-Cal members with special healthcare needs who are unable to schedule and coordinate complex treatment plans involving one or more medical and dental provider. Case management services are intended for members with significant medical, physical, and or behavioral diagnosis. Slide. All right. Case management services are initiated by the member's medical provider, dental provider, caseworker, or healthcare professional, and are based on a current comprehensive evaluation and treatment plan. All forms must be evaluated to determine eligibility based on the case management criteria. Now, if they do not meet case management criteria, it will be then routed to the care coordination team who assists members with locating a general dentist or specialist, accessing appointments, translation services, and transportation assistance. All right. Now, for more information about Medi-Cal dental benefits and to help members find a dentist, visit smilecalifornia.org or call the telephone service center at that 1-800 number, 322-6384. We also encourage everybody to follow Smile California on social media for helpful updates and resources. Instagram is Smile California and Facebook is at Smile on California. If you do have any questions, you can email us at that hello@smilecalifornia.org email or that long email of the Medi-Cal Dental Outreach SNC at gainwelltechnologies.com. All right. So at this time, we are happy to answer any questions you all may have.
Thank you so much, Pamela. I did record some of the questions in the chat. Nancy had asked, just curious why the FQHC dental clinics are listed separately and by county instead of coming up as part of the zip code search.
So I can answer some of those questions. The fee-for-service primarily works with individual dentists and providers that own their own practice. As a federally qualified health clinic or rural health clinic, sometimes these are they request of reimbursement is different. They are paid per encounter, and they get paid directly by Medi-Cal. So it separates the way of payment. So in the Medi-Cal dental website, we just have it as for fee-for-service providers to make it more easy and accessible for the providers that are enrolled directly with Medi-Cal Dental, and then the providers that are still participate and render services for dental, but they just request reimbursement differently, and that's our FQHC clinics that are listed in there. So it's just a little bit separate in there.
Great, thank you. Yeah, there was another comment about same for tribal clinics. Oh, that except Medi-Cal, they didn't show up in the search. That's the same reason.
Yes.
Another one said, we regularly find that the provider directory is inaccurate. How do we ensure it's up to date?
So we consistently work with providers and updating their informations. We, request for the provider to update their information as soon as they're not accepting new members. In a dental office, it can get pretty busy, and oftentimes they may not be accepting new patients for that week, but they still want to be on our referral list because maybe they still want patients. So it's very challenging to get the provider to provide that information, as soon as possible. And so we do provide surveys to providers to kind of update their information at least once a year so they can go ahead and update their information. We definitely work with providers consistently to get that information as updated as possible. But if you find that there is a provider that is not accepting new patients, then definitely let us know by one of the emails that was provided in here. Just say, hey, the following provider is not currently accepting. We might reach out. One of our provider relations representatives might reach out to the provider and just confirm if they are or not. And we can go ahead and fill out the form for them and make sure that that gets updated in our website.
Great, thank you. Jennifer, I have your question in the chat, but did you have more to add?
I think there's two Jennifers
Oh,
in the this is Jennifer from Santa Barbara County. My question is regarding the referral form. I know that one of our objectives is to create a closed loop referral. When we if we fill out the form, will we be notified if the child completed the treatment?
By referral, are we referring to the care coordination referral form that's available on the Medi-Cal Dental website?
Yes, yes.
Okay. So unfortunately, you will not be notified. It will be the member or the parents that is listed in the contact list. The care coordination team will directly contact to try and get that appointment set up with the member. And unfortunately, the parents or the member will have to contact you and confirm that yes, they received that information. I don't see if there's a change on that at this point in time. It is directly contacted to the member.
And do you know on average after the care coordination referral form is submitted, what's the time length that they get back to that person?
So I know that they work on those fairly quickly. I don't know the exact time frame on it, but I
For
don't.
this level, it's about
Yes.
24 to 48 hours.
Oh, there we go. See,
Yeah.
yes. I knew it was fairly quickly because they're trying to get those as soon as possible. Obviously, the patient might have some issues with transportation or some other needs, and they definitely want to contact the member as soon as possible. The one thing that I do have to say, though, on this is that it is a one phone call that they will go ahead and receive. So it is not something that the member will receive if they didn't answer, 2 or 3 phone calls, to get this set up. So if they miss that phone call, that's kind of like their window. Then a new referral form will have to be put in place for that member.
Oh, that's key to know. Thank you for sharing that.
Yeah.
great.
I
Thank
know.
you
I'm
so
sorry.
much. We,
Marina's giving us thumb down.
we have several more questions, but I've saved them, and if we don't get to them at the end of the session, we'll be sure to answer them in the emails. But just so we can move on, we'll turn back to Kristen and Anthony, who will walk us through the COHTAC website and highlight a few key tools, including the Oral Health Literacy Toolkit. Thank you so much.
You're welcome.
Yeah, and Gainwell, feel free to reply to the questions directly in the chat if you have that capacity as well. Maybe we can get some questions answered that way.
Sure.
All right. Let's see. I can do this. All right. So now we are going to go on a tour of the COHTAC website. Both myself and Anthony will be giving an overview, and Anthony will be giving some extra information about the oral health literacy resources. All right. So welcome. I'm hoping everybody can see my screen, and it is the oral health, the COHTAC webpage. So at oralhealthsupport.ucsf.edu, this is our website, and hopefully everything you need, or almost everything you need, is here. I want to point out a few things. So right here, this California Oral Health Technical Assistance Center will always bring you back to this main homepage. So if you get down a rabbit hole and want to come back and restart, you can click on this COHTAC label here. And then next across the line here, we have a different menu options. So, and I'll go in depth a little bit into each of them, but right now I'm going to just cover the page generally. Next, we have our carousel where we post some key resources or new announcements. You may have noticed that we have this new LOHP invoice template, which we just added to the website yesterday. This is a new invoice template from Office of Oral Health, and so we've put it on the carousel to catch your attention, and you can link to it right here with its training video. Then we have general descriptions of what we do, a bar with the events that are upcoming on the right. So right now we are in this COHTAC Share and Learn. We also have an area with news and quick links to the toolkits and manuals, as well as down here, way to contact us. You can email us, and then also you could go directly to our Facebook, LinkedIn, and YouTube channels. All right. So I'm going to just move across this toolbar just a little bit to let you know what's here, and I'll highlight some of the ones that I think you may want to use most often. So on the far left, we have the CDPH Office of Oral Health. This is all the information you need about your work plan and the templates. If you click on this first one, Moving California Oral Health Forward, this has your current work plan year. And here you have program letters, you have your instructions and templates, announcements. This is everything from the Office of Oral Health. We have all the Oral Health Bites newsletters available under this bar, and all of the program letters. If you remember seeing one but can't find it, we have all the ones that we were able to find here as well, so you can go back and refer to previous ones. We also have resources and forms. So these forms are in your original work plan, but it's nice to have them all in one place. And then we have some older materials as well. All right. Then if we move over to toolkits, go back to the main page. Under the toolkits, if you go to the link to the template and training video for the invoicing, that's available here too. So the new invoice template, there's a video that shows you how to use it, as well as a link to the template. All right. Now going to this next menu tab, the toolkits. This is where you can go directly to all of the toolkits that COHTAC, Office of Oral Health, and other partners have produced over the years. Anthony is going to give us a really nice in-depth walkthrough of the Oral Health Literacy Toolkit in just a minute. And here are some of the other ones. I wanted to highlight this Leveraging Medi-Cal Innovations Toolkit, in case you didn't know about it. This is developed by Children Now, and it has the Medi-Cal Managed Care Plan guidance on how you can partner. It's a toolkit for partnering with your managed care plan. So it has the toolkit, the addendum, and some additional resources. All right. And I also wanted to mention the National Children's Dental Health Month. We will cover this in our December office hours, but this is a great space where you can find social media messages and other resources to promote oral health. Lots of options. All right, moving along to the right, we have our programs, and I'm going to walk through many of these. So for the school oral health programs, this page has really gotten a lot of love from the school dental programs work group. And we have our program divided up by childcare and preschool, where you can find the brush in the box toolkit. And we'll talk about more with our Head Start webinar. Kindergarten oral health assessment. I'm going to click on in a moment. The schooling dental programs, it walks you through how to partner with schools, how to set up screenings, care coordination. And then the school-based dental program, sealants and fluoride varnish. This is still being expanded upon. So check back in the future for more details there. We have the fact sheet here from the Office of Oral Health about missed school days, available in multiple languages. And we have COA and Sealant social media toolkit that's specific to these topics down here. If you click on the kindergarten oral health assessment, we have a wealth of information about COA. There's background information on the bill. There is a little video that walks you through how to maximize your experience with this web page. I highly recommend that you watch it, and it will show you in more depth everything that's here. But we've divided up these 6 aspects of COA, from forms to communication. And if you click on each of these, they're interactive, and you can go and get all the forms here under number 1, all the way data. There's great templates and instructions on how to manage your data. And all the way down to communication, we have templates for letters and different ways that you can communicate with schools. We also have some FAQs down here. You can click on the gray bar and it will expand to teach you all kinds of things. I also wanted to shout out this starter manual for school staff. It's an editable Word document that you can offer to your school partners that they can adapt to their own needs, and it has lots of great information, and it's a great starting place for them to have everything they need in one place. You all may have heard that TK was added to COA this last year, and so we have and there were lots of questions around that. So we have some additional guidance here on in this right-hand bar where you can read more details. So if you have any questions about TK and COA, I recommend starting here. All right. I also wanted to very quickly go through some of the other programs that we have, which includes fluoride. Here you can see lots of the resources that we have about fluoride and water fluoridation, including this comprehensive fluoridation manual. Tips on how to discuss fluoride with your community, and a lot of resources. We also now have CE for water operators that is available here. You can send water operators to this page to get additional support. We go down to our third program, tobacco cessation. Here, this helps you with your program plan objectives around tobacco. This has a webinar that dentists can take for 1 CE. And we also have this tobacco cessation toolkit that is available. So you can refer dentists here and they can get a free CE. All right. Fine. Next, I wanted to cover our resources page. So if you come to the resources tab, we have 2 options. This oral health education resources, which is kind of our shop window of highlighting certain resources based on different topics and groups. So here you can search if you're looking for something for toddlers, if you're partnering with preschools, or if you're looking for something for seniors, you can click on that age group and go directly to that area on the page. Down here, we also have games and videos and some other kind of fun things. Also, we have this resource center, which is searchable. So you can click on your topic. So for example, some people were asking about mobile dental vans. We would have that under linkage to care delivery. And you can see a wide range of resources around care coordination, clinical care, mobile vans, right? And we're constantly adding to this. We have a bunch of Smile California resources and virtual dental homes, just as an example. And you can browse. So here you'll be able to browse by topic, or if you need something by specific language. There's a lot here to explore. Right. As we move along the right, we've got news and events. So events, we are constantly sharing events, both that Office of Oral Health or COHTAC are hosting, like today's Share and Learn. But we also just put events here that might be of interest to you that are hosted by other trusted organizations, like the California School-Based Health Alliance has supporting immigrant and LGBTQ during challenging times webinar. And we have water fluoridation webinar by CareQuest coming up. So it's always, if you're interested in learning about broad topics, you can always browse here to see what is coming up. And if your LOHP or partner organization is having a webinar that's open broadly that you would like us to post here, please feel free to email it to us. We're always happy to add more topics. And importantly, we also have past events. So if you missed a Share and Learn, or you came late today and you want to get the recording and the slides from today, you can always come in here and search up previous Share and Learns. You can kind of browse down. You can search by objective. So if you were like, oh man, I need help with my program plan around needs assessments, you can search in here by objective to find out resources that relate to your topic. And finally, in the About Us tab, if you want to contact COHTAC, our information is here. And you can also contact other LOHPs. So we have a spreadsheet of all the LOHPs, so you can always reach out to them. Find out if you heard from someone and you want to find them again here, you can open this Excel spreadsheet. All right. I am going to move to, so under toolkits, if you go to the Oral Health Literacy Toolkit, here it is, and I am now going to switch to the slide so that Anthony can talk to us about the Oral Health Literacy Toolkit.
Thanks, Kristen.
Yeah.
Hi, everyone. So in a moment, we will go through the various components of the OHL toolkit. But before we do, we thought we might talk a little bit. You can go to normal view, yeah. And we thought we might talk a little bit about oral health literacy itself and what it means and who it applies to. For those of you who know this already, we'll try to go through it quickly. Apologies if you've listened to us go on about health literacy and oral health literacy before. So health literacy and oral health literacy have had several definitions over time. The most common and the oldest concerns individuals. And it states that oral health literacy is an individual's ability to find, understand, evaluate, and use health information. But more recently, the definition has broadened a little bit to include healthcare professionals and healthcare organizations, each of which contribute significantly to whether health information is communicated clearly. And to put that another way, professionals and professional organizations can also be health literate or not, right? And the significance of that is that it's of course they are of course contributing to the health literacy of the individuals who in the end must comprehend the information being conveyed. So our focus with the project that led to the oral health literacy toolkit was pretty much on how oral health care professionals can support and promote health literacy within organizations and among patients by using OHL best practices. And the OHL toolkit is essentially about those best practices and how to implement them. Next slide, please. So, um, good health literacy, in essence, leads to better outcomes for individuals, professionals, and organizations, but specifically for oral health patients. Good oral health literacy correlates to these points you see on the screen here. So, lower rates of dental caries and periodontal disease, more use of preventative services, better participation in their own care, and increased likelihood that they'll get the care they need. Next slide. So that's what it could do for patients, but for dental practices, for which the OHL toolkit is primarily geared, adopting OHL techniques can also be a benefit, and they essentially improve relationships with patients by increasing patient comfort and trust, increases patient loyalty to the practice, that encourages them to return, and it increases patients' adherence to instructions. And in general, it improves equity of care by making the practice more accessible and welcoming to all patients. All right, I think we can go to the site itself and take a brief tour of the parts of the toolkit. And of course, if any of you have any questions about health literacy or oral health literacy, I'd be happy to answer those afterward. So, yeah, there we are. All right, so the toolkit is the result of a 2-year study conducted by HRA and CDPH's Office of Oral Health. That study showed that guidance on OHL techniques was wanted and needed by oral healthcare professionals. The toolkit itself has 5 components. 4 of them are for providers and 1 is for patients. I should say that all of them have been tested with their intended audience. So in the case of the 4 provider resources, they've been field tested by oral health care practitioners, dentists and dental hygienists and people in the in the office. I mean, lots of different personnel have contributed to the ideas inside of these pieces. And then of course, the patient piece has been tested with people who have demonstrated low literacy skills and therefore find it more challenging to navigate printed resources of any sort. So this main component here, it's called the Oral Health Literacy and Practice Guidebook. Its purpose is really to help healthcare teams better understand and connect with patients, find what OHL best practices work for their particular offices, implement OHL at every touch point of a patient visit, and get started on some basic OHL items by using some of the tools within, such as scripts and templates. The toolkit also includes an assessment that allows users to evaluate their practice from the patient's perspective and determine where they might make adjustments. It's really simple to use, and helps kind of compartmentalize some of the work. Another component, if we scroll down a little bit, is a booklet about a communication practice called Teachback, which some of you may be familiar with, which has professionals confirm that they've been understood by asking listeners or patients to repeat what they themselves have just said. This is a technique that it's an oral technique, obviously, that can be utilized by anyone really when they're communicating. And the idea is quite simple. Again, just to ask people to repeat back what they've said in their own words, just to confirm what's been communicated before moving on to another nugget of information, essentially, right? So in this particular tool, what you see comes in 3 languages, English, Spanish, and simplified Chinese. It provides, again, basic instructions for how to do that technique, but also provides scenarios with scripts in order to help practitioners practice the skill. All right, next, another component, this is the patient piece, is a booklet about, I'm sorry, pardon me, it's did we skip the action plan ahead? Apologies. No, maybe it's the last one. Yeah, okay, it's in a different order. All right, no problem. If we go back up to the
Which one do you want to do?
yeah, let's do the I was going to do the patient one last. So let's do
Okay, action plan.
the action plan. Thank you. Sorry. So the action plan is really simple. It's just a place to record the goals and the steps to achieve those goals for the healthcare teams looking to implement health literacy in their practice. Uh, Again, give you a quick view of it here. Very straightforward, short resource for people to use. And lastly, we have the patient piece resource that explains the before, during, and after of dental visits. And the idea is to essentially help shape expectations for people who have not been to the dentist much, and to lay any fears and concerns by letting them know what to expect and how to prepare for their visit. As you can see here, it's available in 4 languages: Spanish, Simplified Chinese, English, and Vietnamese. Now, in terms of the usability in general of these resources, especially for oral healthcare professionals, one of the best features about them is that they don't necessarily require a big investment of resources. So anyone who's using these materials can take whatever they like from them and choose to implement them or not, right? The view essentially that we took when developing these and that we continue to take throughout all our work is that any improvement in the health communication is a win. So we really design these to make them, easy to understand, easy to navigate, and highly modular in order for people to just be able to take what they need, and adapt them as they can based on their resources, their interests, their you know personnel and their abilities as well. So it's a very easy to use and friendly resource in general. So I do want to say that these resources will probably be updated starting next year. I think we'll kick off a new project. They have been around for several years now. I think it's been about 3.5 years since they're live. So they'll certainly get a fresh look and feel, so a new skin, and we'll probably update the content somewhat significantly. And we have been adding resources here and there as well, not just via languages available, but there are a few videos that will be going up soon to promote the toolkit, and as well as various presentation on oral health literacy. In terms of promotion for these pieces, we've been, of course, promoting them with dental practices and FQHCs all over the state for the past 4 years or so. And we currently have 2 communities of practices running one in Northern California, one in Southern California, that help promote the kit, that help encourage the use of the kit through various partnerships. So I think we're getting a question here about. Oh, sorry, I thought I saw something about the OHL toolkit, yeah, and how it's used. I think primarily the best ways that you could work with this is to just raise awareness of its existence to any oral healthcare organizations, with whom you're partnered. And of course, if you saw fit, you could distribute or, just promote the patient resource with community members as well, given that they're available in several languages. Again, they're very simple, and helpful for people new to, particularly new to the U.S. healthcare system and the U.S. dental healthcare system. All right, and here's where you can download the kit, obviously at the COHTAC site. So that's what we have today. Any questions about oh, I guess we can go over this too. So um, in addition to the Oral Health Literacy Toolkit, HRA for decades now has been producing the California Parent Guide or Guide for New Parents with First Five California. And for those of you who don't know, that guide is about 86 pages. First Five sometimes has lapses in distribution while they look for various new groups to distribute it. But essentially, it's been available for years and years and years. It's been updated several times. And within that resource, which is free for new parents and can also be ordered in bulk, there is quite a lot of oral healthcare information for community members. And it's a worthwhile resource that's been around for a long time and consistently gets uh, a lot of praise and positive feedback from the community.
Great, thank you so much. There are a couple more questions in the chat. There was
Yeah.
wondering if we can confirm what is meant by the term provider. We have a general CHW team and wondering if this might be an appropriate resource for them.
Could you say the last part again? The general, sorry.
We have a general CHW team and wondering if this might be an appropriate resource for them.
A community health worker.
Health worker, yeah, sure. I think if you're asking if the community health workers themselves could make use of the information in these kits, I think for sure there's communication techniques. I think there are communication techniques that are worth reviewing if you're engaging with community members, especially. There are definitely things in there that would be of note. Or if you're creating materials, I would certainly say there's a lot there to as a community health worker that would be useful uh, in terms of making sure that your information is easier to understand. And I would say too that if you're working with oral healthcare partners, certainly again promoting the kit and raising awareness is a step toward improving community health because you'll be helping to improve or possibly improve the dental arena for patients.
Great, thank you. And I don't know if you know this, but is First Five still providing kits? Our local First Fives that they're not able to order the kits anymore.
Yeah, um, so for a while that I think they had a distributor, and that distributor, I don't know what happened, but the relationship soured or ended, and First Five contracting with First Five could take an extraordinary amount of time. So I think while that contracting was happening with a new distributor, there was a pause. Our understanding is they're available again. And that was information I received just a few weeks ago. So I suspect they should be available. And if you go on their site, all the information to download it is still to order it is still there. So
Great. Thank you. And one more question with Jennifer.
Sorry, I'm full of questions. I just finished my PR6 and I mean, Objective 5 is all about the literacy. Maybe this is a topic for another piece, but it would be good just to clarify like the Objective 5 on literacy because there is different components. There's the 5.1, which is literacy of choosing a campaign. And then it's 5.2, that's where I became confused, where this kit is introduced. And so I guess I'm just me thinking out loud of the way that Anthony put it is for us just to outreach that the kit exists, but on the objective itself, it says that we need to train dental providers. So a couple questions with that. Is there a train the trainer on actually how to train somebody on the kit? Has that been done before? Or are we really just for the objective of 5.2 just supposed to outreach and make dental providers aware that this exists? So if that is the case, is there a campaign that already exists for us to do just the outreach and not the training? Thanks for listening.
I suppose I can answer a bit of that. I would say that in terms of train the trainer, uh, it's available in the sense that we do give trainings on the toolkit that are in more detail than this, and that should be sufficient. But it's in terms of but they've not been organized as such, or we've given them and have had not as many successful results just because I think of in terms of the teams going and detailing the clinics or what we were hearing in the feedback was that there weren't enough relationships to make that process worthwhile. So the way we started looking at it is that any promotion to raise awareness of the kits is probably the best bang for the buck in the sense that the toolkits themselves are really simple and self-explanatory. There's nothing complicated about them. Really, the kind of training that we were doing with LOHPs and other groups was just to say this is what this resource is, this is what it does, this is and to give a broader perspective on oral health literacy itself. But those trainings were, 50 minutes. They weren't extremely detailed. They were really just about trying to again raise awareness around the toolkit and its components.
And hearing you, Jennifer, I think maybe we can increase coordination a little bit between HRA and COHTAC if they are having a training on the toolkit that's upcoming that is open to broad membership or like just a broad audience. We could let LOHPs know so you can promote that training to your dental providers. So we can look into that more closely. All right. Thank you. We're now going to move. I know there's a lot today. Thanks everybody for hanging in there, and thank you, Anthony, for presenting that information. We're now going to move on to just some highlights of some resource sharing that we wanted to make sure all the LOHPs knew about. And so I welcome Khadijah back to present this information.
Thanks, Kristen. So here we have some additional resources and tips that we shared throughout the year. From our two convenings earlier this year in Bakersfield and Sacramento, we gathered and summarized the key big takeaways and strategies around topics like care coordination and referral management, school dental programs, community water fluoridation, and work plan strategizing. The second resource we have here is that the California Pathways to Public Health program offers both internship and fellowship opportunities for students that are interested in pursuing a career in public health. The spring application closed last month, but it will reopen for fall 2026 between March and April of next year. Their website also includes timelines for future fellowship cohorts. The third one we have here is that the ADA and the CDA both have free downloadable fluoridation fact sheets that can be great educational tools for your local programs. And finally, Colgate Bright Stars, Bright Smiles, Bright Futures virtual van program offers 20 to 30-minute live virtual sessions for kids under 12. And the link here takes you directly to the Google form to request a visit. So also feel free to share any additional resources and tips that you may have in the chat. Thank you.
Right. I think we can, if there's any remaining questions, I think we can go over them now. Gustavo.
I just wanted to clarify on the attempts for the care coordination and dental case management. I put this on the chat when responding to one of the questions, and I did confirm with the manager in that area. So it is 3 attempts for the care coordination to try and reach the member, and 6 attempts for the dental case management. So wanted to say that out so everyone was able to clear. Maybe some of you didn't look at the chat, but I already put it in the chat. It's in there as well. So I just wanted to say that. Thank you.
I have a question, if I can throw that out there. I have a couple. Number one was when it comes to the sealant program, so we are trying to implement a sealant program here in El Dorado County. And one of the hurdles we're coming across is actually getting fluoride. We would like to implement fluoride as well with the sealants as we go along. And I know that with our grant funds, we cannot purchase any fluoride anymore. So I was wondering if any of you guys know of any resources where we could get fluoride for that particular program. And then as well, our Head Start partners here in El Dorado County asked us as well for fluoride. They have volunteers that will do the screenings and families willing to get fluoride, but it's a little bit more difficult to get it to them. So if there are any resources out there, that would be wonderful.
Thank you. If anyone has any resources, feel free to add them to the chat or speak about them. Otherwise, we can follow up.
Okay. Then I have one more other question.
Sure.
So as we're talking needs assessment, or the CHIP, or those bigger reports that are coming up. So are there actual websites? So there is a few sites that I came across where I can find some data for El Dorado County, but most of that data is really old. So it's either 16 to 20 or so I haven't really been able to find a lot of information for El Dorado or Alpine County when it comes to oral health with more current info. Am I missing any sites? This is usually something, our epidemiology department would do, but we don't have anybody there. So
have you looked at CHIS?
I have not. I don't know.
I'll put up in a minute. I can find the link. We had some presentation from the California Health Interview Survey previously, and we have some slides that help you figure out how to search by county so you can get county specific data.
That would be wonderful and very helpful. Thank you.
Janelle, do you want to call on the next person or do you want me to?
Sure. I was just trying to get through the chat questions, but
Yeah.
Let's go to Ariel.
Yeah. Thank you, Janelle. And my question was in response to Gustavo, but just Andrea, just in response, and I see you're on the phone, so maybe I'll save my comment to her at the end. Gustavo, we had for care coordination, there was a bit of confusion from one of our community members who was seeking support due to a language barrier. So I'm curious if the care coordination team now has more bilingual staff or staff who speak Spanish. I'm wondering if you can speak to that.
I'm not sure. I don't at this point in time. I don't have an answer in regards to their staffing and if they have more bilingual staff. I know we do offer bilingual services when the provider and the member are in the dental office and require that assistance. I will have to get back to you on that and confirm if when there is a language barrier, what's their process, if they get a translator on the line to make sure that we get the right time, so the member is there present at their appointment. So I'll have to get back to you on that.
Thanks, Gustavo. And just to clarify, the confusion was actually over the phone. The member spoke only Spanish or was more comfortable speaking in Spanish, and there was a translator on the phone, but there was some miscommunication that happened, and it caused several months delay. So, this is one instance. I'm not sure, but my team, some service organizations I work with were curious about that, so I thought I would ask since you were mentioning it.
Yeah, I'll have to find out from that area, and provide, I guess, a more clarify answer on whether or not they do offer, if they do offer a type of like interpretation service during the call, but or if the agent just spoke Spanish and didn't quite understand what was going on, and again, that could be another issue. So I guess yes, I'll get the information and then I'll reply back to an email to the team.
Thank you, Gustavo. I appreciate it.
You're welcome.
All right, Angela. If not, we can, there are some questions. Sorry, I'm not going in order. There's been lots of good discussion in the chat. We have a question about, are we having an in-person project directors meeting hosted by the Office of Oral Health in the spring of 2026? Will COHTAC be hosting another in-person meeting this year as last year?
Hello, sorry, this is Angela. Can you hear me now? Sorry, I was muted. I could.
Oh,
So yeah, I just had a question, and this may be above many people on this phone call, but it's really just in regards to the PAVE applications for local health departments to become credentialed. There needs to be like a clear PAVE enrollment pathway or exemptions for LOHPs so our RDHs can provide their full scope of practice during these school-based oral health programs that we're doing, especially with Prop 56 fundings being cut, in the future. So we're currently working with Alexa, who's the section chief at Denti-Cal, to find out the proper pathway for us to become exempt or be identified in the correct PAVE application exemption. So I'm just throwing that out there. So if anybody knows, or if you guys work directly with Denti-Cal, because I know many other local health departments are going to want to get on board with this. And there needs to be like a clear understanding of how we can increase our services in these rural areas where they're so needed and to be able to bill, and provide services so we have a sustainable program. So I'm just throwing that out there as a question, and you can answer it later. But yeah, just wondering, for everybody else, like how can we make this happen so we can provide services and be reimbursed for these services?
Thank you.
Yeah.
All right, we can try and pull a more comprehensive answer for you, Angela. Thanks for bringing that up. I'm going to jump to the question that Janelle read from the chat, which was that there's an in-person project directors meeting this year, but is there going to be an in-person COHTAC convening? And there is not going to be an in-person COHTAC convening this year. We will be doing all of our work virtual this year.
Thank you, Kristen. Well, thank you all for your thoughtful questions and discussions. And I apologize if we didn't get a chance to your question today, but we'll definitely follow up by email. As we close, we just want to extend a sincere thank you to all of our presenters and to all of you too for participating in today's Share and Learn. Please take a moment now to complete our evaluation survey. We will drop the link in the chat. Just to note that there's a few more questions than usual, but we really appreciate your feedback, and it helps us plan for future sessions. Also remember to, oh, go ahead.
I was going to say there's some additional questions for you that we'll be sharing with the Office of Oral Health. So please take a moment to fill out that poll.
Thank you, everybody.